welcome back. This is TLC Cares, and I'm Jolene Cicchese, a registered nurse with TLC Private Home Care. I'm here today with my sister Cindy. We're going to talk about summer safety tips for seniors. Welcome again.
Thank you.
We've had her on before, and it's great. So we have a whole bag of things to show you to help you, so you can visualize what we're going to be talking about today.
As we talk about it, Jody, maybe our patients can look around their homes to make sure they have what they need. Sometimes everything you have in your home is right there, but because we change the season so fast, you're just not used to taking out your stuff for summer. So today's a good day to bring your summer stuff out.
And happy summer, everybody.
Yeah, summer solstice.
Yeah.
We want to make sure our seniors have really good eye protection. Pretty eyeglasses, pretty summer sunnies are great. We want to protect the side of their eyes if they have glaucoma or macular degeneration, or take eye drops in the morning and the night. We want to make sure that their eyes are protected. And you do wear regular glasses, so we want to make sure your sunglasses can be prescription if they need to be. Another great protection piece is your TLC Private Home Care lip SPF 15. We want your lips to be protected because we don't need them to be swollen. If you wear lip gloss or lipstick, which is what you wear in the winter, you could get swollen lips, and you wouldn't know if you were having an allergic reaction to some summer food or a summer bug.
My lips get very swollen if I've been out in the sun too long.
Yeah, so SPF is the way to go. Mm-hmm. Now the other thing, if we're talking about that, is to make sure you are hydrated and make sure you have your really your cool water bottle.
Always have it with you.
Yeah,
always.
Don't leave home without it. I tried today, but I jumped out of your car and ran back and got it. So you want to make sure you have enough hydration all day long. And one bottle is not enough, so you will be refilling.
How many bottles do you think we need?
You want to do at least, well, I would say 4 to 6. It's hard to get them all in, but you should try. I try and fill up 4 bottles in the morning and then go through the day.
Right, and don't let them don't let a plastic bottle sit in the sun.
Yeah, plastic's not the way to go.
Better than nothing.
Better than nothing, but something that is more, keeps your water cool.
And if you're at a backyard barbecue, this is where you should go to take the water.
Yes. You can also use one of these handy dandy bags from your canal days. It's insulated. You could keep it in your car for even when you're going grocery shopping. It's wonderful to have cool things in the car. Now, going back to protection, not only are you protecting your food in the car, but you're going outside in the sunshine. The sun is really hot, so you want to protect your head, your hair. Some gentlemen do not have all their hair on their head anymore.
So a nice floppy hat, which will protect as much as it can.
Yeah, you want to protect your ears, the top of your ears, the top of your skin on your head, the top of your nose. So yeah, you will look very Jackie Onassis. And it's a good feeling to know that you are protecting yourself.
And being in style at the same time.
Yeah, looking good and feeling good. It's the way to be. Mm-hmm. Now, if you're going out with your daughter and your son and your grandchildren, you want to protect your skin in the home. So the first thing you're going to do is, instead of putting lotion on like you normally do in the winter, it's now summertime, so you're going to lather up with your sunscreen.
And this one is good because it just sprays on. It's nice and easy. It's 65 SPF. You can stay in the sun 65 times longer than any other time. And this is wonderful. Always make sure you spray your feet all the way to your fingertips.
It doesn't matter that you use Banana Boat. You can use anything you have in your home as long as it's not expired and as long as it's not something that you're allergic to. If you're Italian, you think you don't need, because you have the beautiful olive skin, you think you don't need as much SPF, but you do. And if you're Irish, you need a whole lot more. You just want to protect your skin based on who you are and where you grew up.
I wish we had known this when we were younger, because baby oil and iodine is what we used to do as lifeguards. So
Coppertone came out very
we may
late.
be paying for it in the future.
Another wonderful thing when you're in your car, going to the beach or going to a family function.
Definitely protect when you get out of the car so it's not that hot when you get back in.
This goes right on your windshield and just makes it a very dark environment in your car.
Keeps the car a little bit cooler than normal.
So that when you get back in, it will feel much more comfortable.
And if you don't have one of these, you can use a towel.
Yeah.
You can use anything that you think of that might help protect and keep the inside of the car a little bit cooler than normal.
And I'd also like to talk about your shoes. You're wearing socks with your sneakers, so they're very sturdy shoes,
Yes.
and you also have socks to protect from any kind of sweating, because when you get overheated, you could sweat, and so that will protect you from blisters. We're all about protecting your skin in the summertime. We talked about your nose and your lips and your sunscreen, but we also want to keep your feet very safe and dry. And if you are a diabetic, you know the importance of keeping your feet, because your toes
Covered.
your toes are the farthest thing away from your heart, so they don't get as good a circulation as they do with your hands and your fingers.
And we can also say beach shoes. The beach shoes you can put on in your home, and you can wear them to the beach, and you can wear them back home. They have good, nice
Tread.
grips, and you can also, they're elastic, so you would always be able to tell if your feet are getting too swollen. Beach shoes are great, and they're pink for TLC Private Home Care.
Yeah, they don't blend in. The feet are the most important thing. Always throw an extra Band-Aid or two in your purse for like blister Band-Aids. They really help heal and protect your skin. But we want you to inspect your feet every morning, every night.
Right.
And
if you can't reach your feet, which a lot of people can't,
Right, it's so
ask your neighbor or
hard.
ask your children, or put a mirror here and hold up your foot so you can see the
bottom
bottom
of
of your
your foot.
feet. Very
We want to
important.
make sure you don't get any sea glass in your feet or any barnacles, or sand in a wound can give a huge infection. So you need to soak those feet and get the sand and the bacteria out.
Okay, so now if you go to a barbecue,
Well, if you're very lucky if you've been invited, and if you feel up to it and your blood pressure is not boiling, then you definitely need a very good chair. Now Jody's going to explain how to sit properly.
always make sure that you grab onto the handles. Make sure it's nice and sturdy so you don't fall over, and then you can sit back and be nice and comfortable. If it's extremely hot and the weather is sunny in your area, you can put up your umbrella and you can have a nice day at a cookout or at the beach.
And that umbrella is really
Backyard.
great because it's protecting you, because it's not a see-through umbrella. It's
Right.
really got that nice sturdy color of darkness.
So let's talk about the hazy, hot, and humid weather.
The hazy, hot, and humid weather, Jody, is quite the Jolene is quite the challenge.
It is.
So what you want to do is listen to your favorite meteorologist in the morning. I choose Channel 5 in Boston. You can choose any channel that brings you joy listening to the meteorologist. You want to know the weather for the day so you can be very prepared.
Lightweight clothing.
We both wore lightweight clothing today, and it's very loose fitting. Now, you'll be in your home and say it's winter time and you have your heat on. Suddenly in May or June you shut the heat off and you want to put the air conditioning on. You don't quite want to put it on yet, so you're going to put your fan on. When you put your fan on, it's something new in your home and you're going to have it plugged in, and this plug could cause you trouble. So know where it's plugged in and be very mindful of stepping over it. We don't want
Right.
you to be tripping and falling.
On the floor.
And we also don't want you to have the loose carpets so that you trip and fall. We want you upright at all times. We want you to know what's on your floor and be very, very careful of your plugs,
And
the
make-
new plugs.
The new plugs. And make sure you always have your cell phone on your person with your emergency contacts plugged in already, so you can easily access them if you need to.
It's like wearing your lifeline. You just have your phone with you if you can, because it is a way to reach your family members.
Right.
The hazy, hot, and humid days, we've already talked about how you protect your skin.
Right.
If you cannot get cool in your own home, you could always call TLC. We know this because you can send people to the Elderly Senior Citizen Center. You could go into your local bank. Banks are always very
Right.
cold. And you could go into your local restaurant. You don't have to order a large meal because summer seasonal food is very lightweight and it makes you feel better. It's very crisp and very clean and green, and it's like watermelon and strawberries, which is full of water.
And sometimes the restaurants are cold.
Yes,
so
they
we
are.
always have our jackets or sweaters.
We dressed like little old ladies today in the loose-fitting clothes, and we brought an extra sweater in because you never know.
I always get cold in a restaurant.
Yeah.
So.
Well, and if you're on a beta blocker, so if you have a chronic illness and they're trying to slow your heart down, you get cold naturally. So
And
you
easily,
do.
yes.
You do need something warm.
While we're talking about the medication, there are some other medications out there that you are not supposed to be going out in the sun. I want to make sure that everybody at home knows to always check with your doctor, but there are a couple that we know
They stand out.
that stand out. So let's
It's
talk about
sulfur.
those.
Your sulfur antibiotics. A lot of people are allergic to sulfur, but sulfur is a drug that we use a lot. You get very sun sensitive. You get burned. I don't even know the percentage rate, but you burn much quicker. You are much more
Right.
susceptible to a sunburn. The last thing we want is that. And if you're on an antibiotic for a reason, you may not want to be in the sun because of that reason,
Right.
whether you have a urinary tract infection or a respiratory infection.
Right.
And when we go to the hazy, hot, and humid days, the humidity really
difficult.
wreaks havoc on your lungs,
Makes you have difficulty breathing.
which you could be taking prednisone
Right.
for. And the prednisone is another medication that you don't want to be in the sun with.
Exactly.
So two big deals, prednisone for your lungs, if that's what you're taking them for. Maybe you're taking it for arthritis or some autoimmune disease, but you just don't want to make your skin more sensitive.
Right, and it definitely is.
It does.
What about the hours? Let's talk about the hours in the day that, when you have a hazy, hot, and humid day, 10 to 4 is what the meteorologist will say.
Yeah.
Please stay inside from 10 to 4.
The CDC says it also. These are tried and true, evidence-based times of the day where you don't want that sun to be beating down on your body. You've got your body to 80 years old, and you want to keep it healthy and happy in the hazy, hot, and humid days.
And those our age, we should be calling our parents and checking on them.
Right.
And elderly neighbors, we should also be checking on them.
Walk over with a glass of water and say, hey, let's share a glass of water before we go out for the day. It's only 8:30 in the morning. Let's have a glass of water before we leave.
Right.
And that would be best, like if you did your busy work in the morning, if you had to go to church or if you had to go get your groceries, get up and go at 7 a.m. It is a very cool time of the day, and you won't be susceptible to the illnesses that come from sitting in the sun.
Plus, grocery stores are nice and cool.
Grocery stores are very cold.
Very, very cold, yes.
And you
they
can
are.
hang on to that carriage for dear life.
So, talking again about protecting the skin, what comes out a lot in the summer is mosquitoes
And greenheads.
and greenheads. And so any type of repellent is a definite. And there are
Yes.
some people whose skin is more sensitive. My husband's one of them. The bugs don't go near me, they go straight to him and they bite him.
And they bite me.
Yeah.
And you want to spray especially on your ankles because that's where the little tiny gnats want to hang out. And don't wear your pretty perfume in the summer.
Attracts them.
The perfume that you want to wear is your sunscreen and your insect repellent.
Right.
And read the label. Make sure it is something good for your skin. If you want something more organic, get organic.
Right.
It matters that it protects you. It doesn't
that's
matter.
all that matters.
That's correct.
That's all that matters.
Right, and if you do get bit by a mosquito or a greenhead, you do want to check that in that site. You don't want it to get red or raised or have any kind of infection.
Right. Neosporin, antibiotic
Right.
lotion.
Yes.
So-
That ointment is really wonderful.
Yeah.
But you do have to be very careful of your skin. That's the biggest part of your body that protects you from everything.
Let's talk about salt in the summer.
Salt. Your Cape Cod potato chips, your
Yes.
corn on the cob, everything has salt in
Everything.
it.
Yeah.
And your diet all winter and all fall, you've done such an amazing job of lowering your sodium intake because your cardiologist told you to. And suddenly your daughter says, let's have a 4th of July party.
And you have a hot dog and potato chips.
Oh my goodness.
And all of a sudden your rings are tight and your hands hurt and your feet are swollen.
And your chronic illnesses are showing. And you don't want that.
Right.
You don't want anyone to know that you have congestive heart failure or that your lungs, you have respiratory compromise. You want to eat 2 potato chips, not 2 dozen.
Right. And a bite of a hot dog.
Right, a bite of a hot dog because, you satisfy yourself. And you
Right.
want corn on the cob, but don't throw the salt on it.
Right. definitely.
Yeah. Eat the watermelon, eat the strawberries.
And the salad.
And the salad.
And the blueberries.
And the shortcake, right.
All of a sudden it's summertime and the fruit is
Plentiful.
amazing and it's there. So that's
and it's
when you
usually
should-
very local, very fresh. So not only are you supporting your community that supports you,
right.
you're making better choices for yourself. It's all about choices
It is
at
all
the end
about
of
choices,
the day.
definitely. And when the heat is high, do not exercise outside. Do not go for your 3 or 4 mile walks. It might be a little too dangerous
It would
at that time.
jeopardize your health.
Go to the
right.
senior center, do a chair exercise class, or pickleball inside. They have those out there.
Yeah.
But
Some of the levels of heat exhaustion and heat stroke, there are levels. And if you find yourself sweating and you just can't catch your breath, that's like the first sign that you need to stop and slow down. That's I wrote all my notes down so I wouldn't make a mistake, but that would be dizziness, lightheaded. That would be a syncopal episode where you're
Right.
just getting ready to pass out. We don't want you to pass out. So if you start to sweat and dizzy, lightheaded, oh my.
stay seated.
Stay seated.
Tell someone.
Yes. Holler, I need help over here. I am unwell.
Ask for water.
Ask for water. Lay flat. Put your feet up. Just take care of yourself and stop. Stop what you were doing. If you were out for a walk at the beach and you felt all these things and you're walking with your daughter and your grandchildren, tell them, help me back to a cooler environment.
Speak up. Make sure that they know that you're not feeling well.
Right. It is all about speaking up and in your environment because it's summertime. Summertime is a short, wonderful period of time, but it can wreak havoc on you if you have a chronic illness.
Especially as we get older, when our bodies are not the same as when we were 20 and 30 as you are when you're 60, 70, and 80.
Yeah.
So
Yeah.
it's fun getting older.
Yeah. It actually is. It's a privilege and an honor, but it's hard.
It is hard.
And the other thing we worry about is you get cramps in your legs. So cramps could also mean blood clots, so we worry. You might be a little bit more sedentary in the summertime and you're not doing your 4-mile walk, but cramps are usually related to not enough salt, too much water, or the opposite.
Right.
We don't want you to have too much heat on board causing you to have cramps in your muscles. They hurt.
They do.
And they are indication that you need to be seen by your local physician who knows your body better than anyone.
Right.
But it's we talked about the swelling in your feet, the
Right.
edema, the heat edema. So fingers, your rings are too small, your bracelets feel tight.
I feel that when I have
When
a
you
few
just
potato
walk,
chips, when you just walk
right.
in the summertime, you can feel that definite tingling and you know it's there and you probably need to drink some water
More water,
to
right.
urinate
And to be
salt
much
out.
cooler. We always say that drink until you pee and pee a couple of times.
Right.
And then you'll know you're a little bit more hydrated and your urine won't be so dark. It'll be golden yellow again.
And get enough rest. Rest is huge. Rest
isn't
heals
it?
the body, so always make sure that you are rested to do anything that is going outside when it's really, really warm.
And if you're only 60 like me, naps can be the secret to your success. So if you take a nap in the afternoon, even if it's just for 60 minutes, you can go out with the kids
Right.
in the evening when it's okay for you to
When
go.
it's a little bit cooler.
The other thing is, Jolene, is that I worry that people will feel obliged to go everywhere, to meet
Right.
every event. You don't have to. If your mindset is like, I'm tired, stay home. Listen to your body. If you just feel that social anxiety that I just don't want to be with 27 people where I
Yeah.
only know 20, don't go. Stay home.
Right.
Feel good about your decisions. It's always about choices.
And if you are too hot at a cookout, ask to go inside.
go home.
Or go home.
Go home.
Yes.
Right. We don't want you to get that heat rash, that heat exhaustion, that heat edema. That's one step gone too far. Your choices prior are when you get the dizzy and lightheaded feelings.
Yes.
That should be as far as it goes.
Yep.
You should stop right there. But just listen to your body. Make sure that you know.
And check with your primary care physician again about those medications. Those are really, really important.
Yes.
We hope that this helps someone. It helps us just to even talk
just
about
to
it.
talk about it. But get your props. Make sure you have your summer essentials. When you look online, sometimes you see five tips. All we did today was talk about all the things. There's lots of things to know about your summer safety.
Right.
Just check everything that you've put into your home and on your body that is different to protect yourself from the beautiful, hazy, hot, and humid sunshine.
And here in Massachusetts, as
Yeah.
everyone knows, we do have July and August coming.
We can't wait.
But stay cool out there. Have a great summer. Stay safe. Again, my name is Jolene Cicchese from TLC Private Home Care.
Put your hat on there, Missy. Nice.
Saying happy summer, and we'll see you next time. Thank you, Cindy.
You're welcome. Thank you.